Here, in this informative video, we will explore the intricate movements of the thoracic cage. The thoracic cage, also known as the rib cage, can undergo various movements to facilitate breathing and other physiological functions. The primary types of thoracic cage movements include: first, during quiet breathing. Inhalation, inspiration. During quiet breathing, the diaphragm contracts and flattens, increasing the volume of the thoracic cavity. The external intercostal muscles also assist by elevating the ribs. This expansion decreases the air pressure in the lungs, causing air to flow in. Exhalation, expiration. Relaxation of the diaphragm and external intercostal muscles allows the thoracic cavity to return to its original position. This reduces the volume of the thoracic cavity, increases air pressure in the lungs, and causes air to be expelled. Second, during forced breathing, forced respiration. During forced inhalation. In addition to the diaphragm and external intercostal muscles, other muscles such as the sternocleidomastoid, scalene, and pectoralis minor can be involved to further increase thoracic volume during forced inhalation. During forced exhalation. The internal intercostal muscles and abdominal muscles, rectus abdominis, external and internal obliques, are engaged to actively decrease thoracic volume during forced exhalation. Third, during accessory movements. Pump handle movement refers to the elevation of the anterior part of the rib cage, similar to lifting the handle of a pump. It primarily involves the upper ribs and is associated with the action of the sternum. Bucket handle movement describes the lateral movement of the ribs, increasing the transverse diameter of the thoracic cage. This is particularly important for increasing lung capacity and is associated with the action of the ribs. These movements collectively contribute to the overall flexibility and adaptability of the thoracic cage during various activities, from quiet breathing at rest to more vigorous respiratory efforts during physical exertion. In addition to the primary types of thoracic cage movements mentioned earlier, there are some secondary movements that can occur in certain situations or under specific conditions. These movements play a role in enhancing the overall flexibility and adaptability of the thoracic cage. Here are a few secondary types of thoracic cage movements. Costovertebral joint movement. The articulations between the ribs and the thoracic vertebrae, costovertebral joints, allow for subtle movements. These joints permit rotation and gliding motions of the ribs during breathing, contributing to the overall flexibility of the thoracic cage. Pump handle and bucket handle movements, anterior and posterior aspects. While pump handle and bucket handle movements are often discussed in terms of anterior and lateral aspects of the thoracic cage, these motions can also occur in the posterior aspect. This involves movements of the vertebral ribs and the corresponding vertebral column. Chest wall compliance. Chest wall compliance refers to the ability of the thoracic cage to expand and contract easily. It is influenced not only by the movements of the ribs but also by the elasticity of the intercostal muscles, connective tissues, and the joints between the ribs and the spine. Changes in chest wall compliance can affect respiratory function. Elevation of the thorax in upper limb movements. During certain upper limb movements, such as reaching overhead or lifting heavy objects, there may be an elevation of the thoracic cage. This is often accompanied by increased activity in the accessory respiratory muscles to assist in expanding the thoracic cavity. It's important to note that these secondary movements are often integrated with the primary movements to achieve a range of motions that support various physiological functions, including breathing, postural adjustments, and upper limb activities. The thoracic cage is a dynamic structure that can adapt to different demands placed on the respiratory and musculoskeletal systems. Don't forget to like this video, subscribe to our channel for more educational content, and hit the notification bell to stay updated on our latest releases. Share your thoughts and questions in the comments below. Thank you for watching.